My name is Holly Farbo. I am the Academic and Industry Relations Manager for Hygiene at Aspen Dental Management. I have been a hygienist for 21 years. 19 of those years I was in private practice. I went to an Aspen Dental about 2 years ago as in an office, as a hygienist in an office, and I fell in love with the way that they saw their patients. So the job came available. There's lots of growth in this company. The job came available for the academic manager, and I applied for it, and I got the job. So now I get to talk to hygiene students around the country and give them information, put aside some misconceptions about DSO and Aspen Dental. So that's a little background on myself. So we have Caitlin as one of our panelists tonight. Caitlin, do you want to go ahead and introduce yourself? Give us a little background and tell us how you got to Aspen?
Yeah, absolutely. So my name is Caitlin. I've been an Aspen hygienist for 3 years, a little bit over. I absolutely love it. I started right out of school. It's the only job I've had. I've worked in a few different offices, but each one runs a little differently, but it's all the same core values and drive, and it's beautiful. I love it. It's the culture I love to work in.
Great, thank you. That's wonderful, thank you. And thank you so much for joining us tonight. So I'm going to start off with explaining what a DSO is. So that word DSO that we use, we'll use that sometimes, and to a lot of people, that is corporate dentistry. We don't like to use that word. I think it seems a little cold, and it's not really what we are. So basically what a DSO is a dental support or dental service organization. Those two words in the middle are intertwined, but I like to use the support because it's all about support. So we have our Aspen Dental offices that are independently owned by the doctor. And then we have Aspen Dental Management Incorporated, which is who I work for, that provides supports for these offices so that the doctor and the hygienist can work on patient treatment, and that is their main focus. So for an example, if a dentist gets out of school and decides that he or she is going to open an office, more than likely they're going to have to hire someone to help them find a location, find an actual office to open, or possibly look into buying into a practice. So that's something that they have to be concerned with. The next thing would be the computer system. They'd have to set up a computer system and payroll and all of those things that they would have to hire more than likely an outside person to do. They teach you how to do dentistry in dental school and dental hygiene school, but they don't always teach you the business side. So marketing, trying to find your patients. If your business isn't doing well, you might hire a partner to come in and help you with that. All of those things that you don't necessarily think about when you're first starting off, we take care of all that for you, so that the doctor, again, and the clinician, the hygienist, can work on patient treatment and not have to worry about all the business side of the dental office. So that's basically what a DSO is. Aspen Dental is one of the largest, we are the largest branded DSO. So all of our offices will say Aspen Dental, even though they're owned by the doctor. His or her name will be on the front, but it'll say Aspen Dental. That way you know you're getting pretty much the standard of care that we feel that should be done as far as the way the patient flow goes. So first and foremost, we'll start asking questions. If you have, there's a little question and answer button at the bottom of your screen. If you have any questions, go ahead and click on that button and you can ask, and we'll try to answer them. We have some questions here that people have asked prior to the webinar, but if you have any live questions, we'll try to get to them as we can. So first question that we will ask Caitlin is, give us a little bit about your day. How does your day go? The flow of your patient. What's a typical day in your life at Aspen?
Okay, so we typically have morning huddle about 10 to 15 minutes prior to the first patient scene. We go over what's going to happen that day, any interesting things that we need to point out. And then I see typically about 8 to 10 patients of my own a day. I interrupt time and bargain the way I use things. Sorry, not great at this. So then I cut out and see new patients, and I help diagnose what their oral condition is. I make time throughout my schedule to do this and allocate things so it's a better flow, so no one feels left alone in the chair. From there, I do my cleanings. We don't like to call them cleanings, but we do our treatment. We go over education. We reappoint them. We discuss what needs to happen in the future, whether it's restorative work, more hygiene. Everyone leaves with an appointment, and we answer questions from there.
Perfect. Good. So you talked about the amount of patients that you see on a regular basis. Do you have a certain amount? Do you have a quota of patients that you have to see per day? Or is there a certain amount of patients that you normally see? How does that work?
There's no quota for how many patients to see. We do have goals, and of course we want to see as many as we can. We want to have a productive day. You want to use your chair time wisely. That's what we do, right? We're in the business of helping people, so allocate it correctly. But there's no quota. No one tells me I have to see 4 patients in the morning and 7 in the afternoon. I charge my own schedule. I make sure that it flows well, that I'm able to see as many people, especially those in infection. So it's more of a daily goal of how much can you do personally, and Aspen supports you to get there and always drives you.
Good, perfect. So that kind of leads me to this next question that's asked about clinical autonomy. So you said that, it's up to you on how many patients you see. So how about your treatment plan? When you treatment plan a patient, how does that work? Or is that something that you can do? Do you have a guideline of what you do? How do you determine periodontal disease, or how do you determine what type of cleaning your patient's going to get?
So we use the ADA standard guidelines. We don't do anything outside of the scope of practice. We do what is right for the patient. We diagnose as necessary. There's no quote on how many SRPs need to be done or prophies in a day. It's what's right for the patient, and we allocate our time that way.
Perfect. So your new patient, one of the things that I loved about Aspen was the way that the new patients were seen. I know in private practice, most of the times the flow of the patient is they come in as a new patient, they may get 10 or 15 minutes more time than an existing patient. And in that time, you would take x-rays and clean their teeth. Then they would see the doctor to diagnose. So can you explain a little bit about our new patient exam and how that differs?
Right. So the way Aspen sets up is the easiest way I've seen in my experience. Typically they come in, they do their paperwork as every office would, but then the dental assistants typically take their x-rays. It's normally a full mouth and a panoramic x-ray. Then they chart existing, they go over medical history and address their chief concern. They come find me, they let me know what their concern is, any extreme findings or things that they have seen themselves. They kind of give me the information before I'm in there. They tell me what needs to be done so the patient doesn't have to address it every single time they see a new person. I then go in, I introduce myself, I do the diagnostic part, I look at x-rays, I look at their health history, I go over any concerns there, and then go through the perio charting with my assistant that helps me. So it's never alone. It's very supportive there. And then from there, I discuss my findings, I express what needs to be done, I answer questions, and then I let them know I'm gonna go grab the dentist. They'll be right in. They're gonna address any concerns that you have, any restorative things that need to be done. And I then let the dentist know what's going on. We have a nice little handoff, and the dentist goes in and addresses it from there.
Good. So that leads to my next question that kind of is a follow-up to that. So say, for example, you have a patient that hasn't been seen in a long time, and you're telling them now that they have periodontal disease. So how do you deal with a resistant patient, someone who's, doesn't believe that they have that, or how do you approach that when a patient, has that kind of an attitude?
So a lot of the time I place that back on them. I didn't give them the disease before they got here. I asked them, how long has it been? Say it's been 10 years or more. 10 years, so you typically missed 20 appointments in your life. You are no longer healthy. You can't get underneath your gums like I can. That's, and I like to let them know that doing the bare minimum or less than that has already put them in this position. To do that now will only be a disservice to them. So we have to address their health now because the body is connected to the mouth, as much as we don't like to think that. It is the
Yes,
case.
isn't that amazing? If you could just get people to understand that your mouth is part of your body, maybe they would, yes. So how about technologies? This is a question that's asked a lot about the types of technology that we use in the office, you know, and especially, you know, for a new patient, what type of technology are you using to show that patient, to diagnose, and then to show the patient what's going on in their mouth?
Right, so we're very fortunate at Aspen. They are very technology forward. We have all digital x-rays. We have the ability to show them on either computer screens or TVs that are set up in the operatories for easy viewing. We have an iTero machine, so that creates a 3D image of the mouth, and we can show the patient in real time, in real color, what is in their mouth at this time. And they can self-diagnose from there, and it's very easy to show someone, this isn't a concern. You can see it, I can see it. So we need to address it. So
yeah, that iTero machine it was one of my favorites. That was just initiated when I was in office, and it's such a nice tool to be able to show somebody a scan 3D. It's not being done, and Aspen, as far as I know, is one of the only ones that does it. So let's go back to new graduates, because that's who I deal with a lot, and that's where we get a lot of questions. Do we hire new graduates at our office?
We do, absolutely. I was a new grad. I went right in.
Perfect. Now, what type of training did you get? Because this is a question that I get all the time from a new grad coming out. They're seeing one patient every 4 hours. That's how it goes. You know, you have to be checked every 5 minutes with the instructor. So their biggest fear is, what am I going to be able to go into an office and just like have a patient, schedule patients put in front of me and be able to actually, you know, do that? So can you explain a little bit, when you first get hired, what kind of training that you go through?
Yeah. So I believe it's a 3-week training course. You are in the office at all times with a hygienist that is your trainer. They've been doing it for X amount of years. They've been seen fit to be a trainer because they're doing that well, correct? So what we do is you're hands-on. First few days, you're not with patients. You learn the flow. You understand how it works. And then you're slowly given patients throughout the day with the hygienist there at all times. Your trainer's always there. You have questions, you have concerns. They help you with your time management, because that is a concern. It's very scary. I hated that concept. But offices are very understanding. They know that something going from 4 hours to an hour, and granted, as you're a new grad, you don't take the entire 4 hours. I understand that, but yet it's overwhelming for me. But they're very understanding. So I was given the time I needed. I was never forced to be able to do an entire schedule that a seasoned veteran has been doing for 3 years, 4 years, 20 years. They are very supportive in building you up as a human and as a hygienist and as for your career. They're never going to say, absolutely not, you're not skilled enough, because we understand it comes with time.
Good. Can you go over a little bit about our HOP program and what that is and what all goes on at HOP?
Yeah, absolutely. So it's a series of courses and lectures, some hands-on, some just lecturing. It talks about how we can do best for the patient and what that means to be a productive hygienist as well. They teach you how to schedule. They teach you the flow of scheduling of patients, better ways to diagnose, how to co-diagnose, how to calibrate with your dentist, with your office manager, how to build those relationships with those you work with and those who you're helping. They train you on the technology, and they set you up for success. You learn the metrics, how you're measured, how you're doing well, how you can grow.
So you mentioned metrics, and I know sometimes that scares people, especially in a private practice. I mean, first and foremost, we are a healthcare provider, but we're also a business. And in that business aspect, and you want to succeed, there are some things that go along with that. So can you explain a little bit about what the metrics do and what they are?
Yeah, so metrics just kind of gauge how you're presenting treatment, what treatment you're providing, how this is helping your population, or how you could better focus. If you're in a specific population that is more surrounded by industrial, potentially more sodas used, and all these different things that are going along with that. So maybe oral cancer screenings, or things that would be more beneficial, home care products, 1.1 gel, or if we should use varnish more often. So, and it kind of measures along those who in your area, as well as Aspen wide, what it looks like, how things are trending, if that makes sense.
Yeah, absolutely. Another question that I get and comes in all the time is about selling. Part of the misconceptions of some DSOs is that it's a big sales aspect of the job. So can you explain a little bit? I mean, first of all, do you feel like you have to sell? And second of all, what types of adjunct products or things do we offer our patients, or we suggest to them? Can you go over a little bit about that?
First and foremost, I am a hygienist. I'm not a salesman. I will only offer a product if it's going to benefit you, or my patient, or who have you. But yes, we have the products, and we're very fortunate to have the products to be able to hand the patient to them in person. You can write the prescription all day, but the studies show that 40% of patients that have a prescription will not fill it. But if you can hand it to them in office, fantastic. It provides the patient the best care they can absolutely get, and it's in your realm of helping them to get there. I do not sell products. I mention them, I recommend them, I tell them it's the best thing for them. But no, I will never push, and I'm not forced to push by anyone. We offer MI Paste, MI Paste Plus. We offer fluoride varnish, 1.1 sodium gel, which is prescription toothpaste. We have differing prescription mouth rinses, chlorhexidine and stannous rinse, but you also control what you provide your patients, what you believe in.
Yeah. So since you mentioned that subject, are you in control of what you order?
Absolutely.
In your office? Okay, so you're able to order what you want to order.
Yeah.
Good. And one of the things I loved about Aspen was that the products that we talk about and that we recommend for our patients were products that I recommended for my patients the whole time that I was ever in clinic as a hygienist. It's just that I never had those at my disposal like we did at Aspen. So those products we keep on hand. We're able to order those products. We stock those products so that when a patient came in and I said to them, I'm recommending MI Paste, at other offices I've worked at, oh, where do I get that? Oh, well, maybe you need to look online. No, at Aspen, we had those products on hand to be able to give to them. So it was never about selling. It was just having the availability for those products so that we could give those to our patients when we recommended it. So that's a really a nice thing that goes on there. So let's put into perspective a little bit of the type of patient that we see on a regular basis. What type of patient generally do we see?
So Aspen's more geared toward the blue collar person and patient. It focuses on those that don't typically have the best access to care. Maybe those that don't have insurance or haven't been to a dentist in a very long time.
Okay, so, and that, that speaks because, sometimes at a private practice, when people say that and differentiate, you have a patient that's been a lot of times coming to the same office for years and years and years. So, maybe they are a pro fee on a regular basis, but we cater to those patients, like you said, who have not been to the dentist in a long time. So that really changes the perspective on, sometimes why we decide to treat a patient the way we do, because it's somebody that hasn't been seen in a long time. So that's always a nice thing to put into perspective. So let's go back to this question always is compensation. Okay. So the compensation question comes up. How much do you make? Now, misconception is that we get paid commission if you have to clock out if you don't have a patient. Can you go over a little bit about the compensation and how that works?
Right. So you're paid hourly, competitive wage, and you have a bonus structure, monthly incentives, as well as a team report card. So as a team, as you get together and you're doing what is right for the patient, that will fall into place. So as a team, you can bonus And then you have an incentive weighted bonus as well as just a hygienist. But even if you never bonus, because you should never count on bonuses, right? You are paid very fairly.
Yeah. And it's really depends on the office and depends on the area. Like I always tell people that, every place is different. You get paid something different in California than you would in Pennsylvania. So it's really based on the area, but Aspen is very competitive in their hourly rate, if not better. So another thing that there are hygienists out there making six figures. I mean, it depends. It really is based off of the office, off of the doctor and how many. So how many hygienists are in your office? Do you have a one or a two office hygienist?
One, it's just me.
Okay. So, and that's a little bit different. Can you explain a little bit about what a two hygienist office would look like and what the rules are there?
So a two hygienist office, in every region and every dentist or office likes to do it a little bit differently. But typically for a two hygienist office, the lead hygienist, you have a lead and you have an associate. Your lead will see all of the new patients, do most of the diagnosing, do most of the initial treatment, a lot of the admin work, just they drive the business. Whereas your associate will see a lot of the recall patients, and their help is supportive. And a lead in just a single hygienist office, which is my office, what I'm more accustomed to, is I see all the hygiene patients, which I love. They're all my patients. I never have to worry about what another hygienist has or hasn't done in the past. If things have slipped or we put things on the wayside, it's all up to me, which sounds overwhelming, but it's very empowering.
Yeah, it is. I was a single hygienist in the office too, and it is nice. So I have a question here that goes back to this with you being a single hygienist. When you see new patients and you already have an existing column of patients that you have scheduled, how do you balance that? How do you balance leaving your patient to see a new patient?
So you find good breaks. And I will say this is something I probably struggled with the most, because in hygiene school, and I don't know if it was drilled in everyone else's head, but you don't leave your patient. They're never allowed to sit alone. Maybe I just had very intense instructors, but that is hygiene school.
Yeah.
So finding a good break, seeing where you can stop, in the middle, that's hard. Maybe you wait while you have an exam, you go grab your doctor and say, hey, I have a periodic exam. I don't see any chief concerns. They're doing well, or here are the other issues. And then you go to the new patient while another dentist, so they're with someone. Or maybe you pull a dental assistant and you get them scheduled for the recall, 6 months, 3 months, 4 months, what have you. If you're doing an SRP, give them a break. Their mouth hurts. Having that water in the mouth is annoying. Give them a break, sit them up. I'll be right back. I'm going to help with an exam. I'll be just a moment.
Yeah. And, sometimes the patients like that. They like taking that little bit of a break,
Mm-hmm.
and honestly, that was probably one of my biggest challenges, which ended up not being a challenge at all. Once you get into it's like any other thing that you do. Once you get into the routine of it, it is a little bit different. And I was told that straight off the bat, listen, that's probably going to be your biggest challenge. But in the end, it ended up being fine. Let's go back real quick, because I have a question about the compensation and benefits. Someone is asking a question, is what type of benefits do you get?
So we do have insurance, dental, health, visual. We have 401k, matching 401k, investment opportunities, as well as personal dental. So your dentist can provide whatever amount of services they allow to you for whatever cost. It's always discounted. That goes along with friends and family, dependents, all of that. It's very fair. It's one of the biggest reasons to go for corporate for most, I would think.
It is. And you know what, like I said, I mean, that word corporate sometimes gets a really bad name because it seems cold, but sometimes the benefits that come with it of having a big organization backing you is our benefit plan. There's so much to offer in that benefit plan that it's right there, that a lot of times in private practice, you might have someone that offers you less money because they offer a benefit program. And so they say, well, let's look at the amount of what a benefits would cost you, and that's part of your hourly rate. At Aspen, we give a really great hourly rate, plus we give all these, oh, it's okay. Listen, it's okay. It happens sometimes. Plus we give a great benefit package. So that's an amazing thing too. So going back to your treatment, is there ever a time that you would refer out a patient for anything? Do you give referrals for certain things?
So again, region to region, a little bit different. I am very fortunate and I work in a region that we have an oral surgeon that comes to our office on a regular basis. So we don't have to send elsewhere. It's really nice to be able to keep people in their dental home, their one and only. We also have an endodontist that comes to our office regularly as well. Yes, there are times we refer out. For ortho, if they have to have traditional braces, we don't do that. We don't offer that. But we have the ability to refer. If we can keep them in-house, we absolutely do prefer to do so.
Perfect. And my office too, when I worked there, also had the same. We had an oral surgeon that came in once a month, and we had an endodontist that was just starting. And that's something we're trying to get more in the endo world, but not every office does. So just to let people know that if you do go into an office, that's not necessarily, it is individual regions. You may not have an oral surgeon that comes in as often, or an endodontist. So it's going to be up to you as far as referring out. So work-life balance, that's a big issue for a lot of people. So what type of hours do you guys work? Because that is one thing that I hear, that I get new grads asking me, oh, we hear that you have to work all these terrible hours. So what is your office open?
So we are open 5 days a week, one Saturday a month, with very reduced hours and a reduced patient base. It's 5 days a week, typically, sometimes 6. The clinic is open on a 40-hour basis in most places in that 5-day work week. There are ACE hours, which are extended hours. Again, it varies, but Aspen never wants you to work more than you can. They're very supportive of work-life balance, and they preach that. If you need time, take time.
Yeah, that was nice. Real quick, I'm just going to kind of elaborate on the work-life balance. Our motto at Aspen is access to care. A lot of times you'll see the Aspen dentals that are in more rural areas, not really in the inner cities, because it's about access to care. We want our patients to be able to get to us. And part of that is being open, 5 days a week, extended hours, one Saturday a month. It's really not uncommon in the dental world. So I don't think that's too much to ask. And one day that we're open later, like you said, there's a half day there. So it always ends up that. So the access to care is an important thing for us. And so that's why, our hours are the way they are. So talk about a little bit about do you guys have a float position available, or part-time? Do you do anything like that in your area?
We do. So regions love to have float hygienists, meaning that you can travel to different Aspens within an appropriate amount of area, and you fill in. So you can do double hygiene days, help see more patients, or you can cover vacations because we offer vacation and PTO. We have one available in the Indy market right now, in the Fort Wayne market. If you guys are around, let me know. But yeah, we have float, and then you can do part-time as well if you want to be an associate. You're not ready to be lead of the clinic, which I understand. Absolutely, you can 3 days a week, or you can do 5 days with shorter hours, whatever would work best for your clinic and your patient base. Absolutely, you don't have to come in right out of the gun, I'm going to work 40 hours. That's a lot to take in. Or maybe you're gung-ho and you want to. You absolutely can.
Yeah. And again, that's another thing that I love so much about Aspen. So I'm just a big Aspen cheerleader, but is that the float position, which I actually consider doing because, I really enjoyed going around to the different offices. So if you're somebody who wants a little bit of spice in your life and you don't feel like being in a single office all the time, the float position offers you that flexibility to be able to go into different offices. And I'll tell you that the incentive for floats is really, really good. So they get incentivized well. So it really does pay to do that if that's something that you thought that you might want to look into. So for some of my people who I know that want to do temporary, I want to temp because I like to be able to see different offices. This is a great position as a float, or, you know, to be able to go into different Aspen offices and you still know the system, but you know, you're kind of, you're at the same place, but you're at different places, seeing different doctors. So our system is a little bit different. And so the question I got was, do you use Dentrix, EagleSoft? What software system do you use in the offices?
So Aspen has their own system. It's called EPMS, the acronym I'm sure I could think of, but not now. It's Aspen specific and it functions really well. During training, it's pretty intuitive. It's easy to learn. You'll learn it through it. Everyone knows it in the office, so you don't have to worry.
Yeah, I mean, it's a learning curve like any other software system when you learn it, yes.
Mm-hmm.
So we have something called the Bridge. And can you explain a little bit about the Bridge and what that gives you access to in the office?
Yeah, so the Bridge is kind of home base for us. It gives us all the updated information with Aspen. It has communication tools throughout office to office or region to region. It gives us that information. It also holds everything that we need, all of our reports for patients, all the information or education that we need, and you know, resources for hygiene, updated guidelines. It has a forum. If you have a question, you can ask other hygienists and they can answer for you if you're stuck or you just want some support. It's kind of everything.
Yeah, it really is. So speaking of support, we have our support is a really big thing at Aspen. That's we really pride ourselves on our support system, especially for our hygienists. And I know for a fact that not everybody does this. So can you explain a little bit about, and what I'm getting at is the territory hygiene manager position and what your territory hygiene manager does for you. And then I can go a little bit on exactly, you know, kind of like the flow of other positions outside of clinical hygiene. But give me a little background on your support that you have and what your territory hygiene manager does for you.
Okay, so there's a lot of support. So your territory hygiene manager is THMS for ease. He provides all the updated guidelines. They create a relationship between you and your office, your regional managers. They are there to help you clinically as well as administratively or business-wise. They're there to help you be the best you, the best hygiene, to drive your business, to treat the patients how you and your doctor want. He or she will answer questions, find things that need to be done in your office for you, or how to go about doing that. If you're stuck with how to improve somewhere, they are your lifeline. They have gone through what you've gone through. They know more. They're there to help you. They take time. They come into your office. They do Zoom meetings. They email you. They check up on you. They show you your breakdown. They're there to build you up when you need it. They're there to give you the hurrahs and the congrats when you do them.
Yeah. And, you know, I think a misconception, and I know I had this, was that we have these people that are going to boss you around and stand over your shoulder and tell you what to do. And, you know, that never, ever happened to me. My territory hygiene manager was so supportive. And she, like you said, you know, is there for you when you need that extra support. So when you feel you're in a private practice and you feel like you're on an island by yourself as a hygienist, you know, who do you turn to if you have an issue or a problem? I mean, there's lots of job boards you can get onto, but you have an in-house person right there, the territory hygiene manager, that is there, you know, whenever you need him or her to help you out in whatever aspect. Because like you said, they have more experience, they've been through Aspen, whatever that may be. So that leads to a question, and you may not know this, Caitlin, so I will kind of ask this because this is the question that gets asked, is what other jobs are available to hygienists if they decide they don't want to do clinical anymore. And territory hygiene manager, like you said, is one of them. The next step up from that would be the division director of hygiene support. And again, this is just a big network of support that we have. So for our territory hygiene managers, they have a division director that supports them in the business aspect of it and everyday life there. And then you have my job, which is on the academic team. I work with hygiene students. We have learning and development. There's just so many avenues you can go to. Your entire career could be spent at Aspen Dental without ever having to leave. There's so much more there than I ever thought imaginable. So it's a really nice way to start your career. And some people love it. I mean, like some people will continue throughout clinic forever, and that's great. We have that available for you. So if just say, for example, the question that I get is, if I decided, like if I started in an Aspen office in Indiana and wanted to move to Florida, is that possible within Aspen?
It is, absolutely. To transfer to one office to another, as long as there's need, they are very fluid and they help you go there as easily as possible.
Yeah, that's the great thing. I have a person that I know in Aspen, and they actually helped her get her license in another state. So we have 830 offices. If you decide you want to move, we love when that happens, because if we need somebody in that area, we already know that they know Aspen. So going back to your clinical, what other services do you provide other than your cleanings and your SRPs, gingivitis treatment? What other services do you do on a regular basis at the office?
Education, right? So sealants, preventative, home care products, oral cancer screenings, the best technology there is for it at this point. Intraoral cameras in a lot of offices. The iTero is fabulous for that. We offer Invisalign. We can coach on those sorts of things because you want to be more proactive rather than reactive, and Aspen sets you up that way.
How about whitening? Do you do whitenings in your office?
We do. We have Zoom whitening. We have 2 separate systems in office as well as take home. Good.
And another thing that's unique to Aspen is we have our own labs. Do you have your own lab there in lab tech?
We do. We're very fortunate to have that. It keeps everything in-house again, so patients don't have to go here and there. It creates faster return to go from having teeth or no teeth to getting a new set of teeth.
Yes, it does. That's a nice transition too, when you get to see your patient do that. So as far as implants, this is something that I know we're initiating even more of in the future for our new doctors coming on, is implants. Does your doctor do implants in the office, or is the oral surgeon doing the implants?
Both.
They both do. And how about implant maintenance? Do you see that on a regular basis?
I do. Especially when they first get them, I like to see them more regularly and then go from there. But Aspen provides really great training on that, because that is not something I felt I learned enough. So when your doctor places them, they want them to succeed. So you learn how to take care of them.
So training, CE, is that available to you?
It is, absolutely. They offer so many varieties and so often. It's very, very nice. I know it's difficult right now with COVID, but hopefully, the powers that be make that easier for us when we're renewing. But yeah, a lot of live and a lot of in-person when that's possible. And they're free.
They are free. And I will give I'm going to give a little plug right here. If for anybody, we are now at Aspen giving free CE. They're live webinars. They count as a live classroom at aspendentalce.com. And that's for anybody that needs CE, free until March of 2021. So that's my little plug. So another question that always comes up in hygiene schools, because hygienists in school are very passionate about giving back to their communities. They have a community outreach programs at schools. They have community dental health. Can you tell us a little bit about what Aspen does to give back to the community?
Yeah, so we have quite a bit of outreach. We have volunteer services for veterans or any dynamic. There's also overseas opportunities, or in other states, you can volunteer to do so. We give back to the community in so many different ways. And then Aspen is already geared towards those patients that need it, but what about those that still can't access it? Aspen still comes in and tries to save the day.
So this question came in. What type of, so if for a new person coming into Aspen, what type of personality or what type of person are we looking for to fill a position at an Aspen Dental?
Someone who always wants to continue growth and learning and skills. Someone who doesn't want to become stagnant, and, you know, that wants to work, wants to help others.
Yes, exactly. And I always tell this, I say, I give a life lesson to my students when I talk to them. And this is true for any place that you go. Sometimes it starts with you as a person. When you go into an office, we're looking for team players. You know, we want somebody that's going to, you know, stand up and say that they're willing to help, because when you do that, first of all, the office runs better. And second of all, you get help in return. So how many assistants do you usually have at the office? Dental
Three,
assistants.
Three. Yeah, some offices can function with 2, others with 4. It's just dependent on your patient basis and practice and dentists, but typically 3.
And so do you have somebody that takes your x-rays for you, or who takes your x-rays? Do you do that, or does somebody else?
For new patients, it's the dental assistant. For my recall, I typically take them, but the dental assistants are very quick to jump in and help. You don't have to take every single x-ray. That's not who you're going to become, because you, again, support is there. If you run behind, someone's going to sweep in and help.
Good. Perfect. So how does the patient handoff to the dentist go? Does he or she check your patient? Do they make sure that their diagnosis is, do they look at that, or how does that go? How does your conversation go with your doctor when you're handing that patient off to he or she?
I give a little bit of a rundown. These are my findings. This is what I'm seeing. This is what their concern is, if they have one. My dentist will always look over what I treatment plan or diagnose as much as we can. We co-diagnose. You want to calibrate with your dentist what you believe is this and what they believe is this. You should always share that value, and they're there to back you up. The dentist isn't there to say, nope, this is what I saw. They trust you and you trust them.
Perfect. So if a student wanted to go about getting a job at Aspen, what would your suggestion for them to be? What would you suggest for a student to do?
Ask to shadow if possible. Call an office, see how it runs. That's what I did. I wanted to know how, you know, it's overwhelming, and my professors did not teach for corporate dentistry or accelerated hygiene or what have you. They all came from private practices, so I didn't understand it. Ask to shadow. Training, ask about that. Ask how they interview the office as much. Make sure you're a right fit. Don't just take the job because you think something or you hope for something.
Right. And we're going to get to that question really quick here, but yeah, we're very transparent, Aspen. That's a great thing that, you know, we do these AMAs because no question is off the table. We want people to ask those hard questions because we have nothing to hide. We're transparent. We like to do the shadowing. We want you to come in and see how the office runs. It's not like we're trying to hide it from you or pretend like we're something that we're not. And I love that part of it. Mm-hmm. So this is a hard question sometimes, but there's some negativity that you see on social media that you might have these preconceived notions. How do you deal with someone who says, oh, don't go to Aspen Dental, you never want to work there, I can't believe you work there, whatever you may come across? How do you approach somebody who gives you negative feedback on an Aspen Dental?
A lot of the time I like to discuss the internet with that. For 10 fabulous things someone does, one person may tell you that they had a good experience. Whereas if one situation, one poor issue happens to someone, they're going to scream from the rooftops and other people are going to rally behind. That's the society we live in. It is what it is. So Aspen does good, you know, and we don't talk about that. So a lot of the time it's easy because we are branded, like you said. It's easy to point fingers and say this, that, or another. But what do we offer? So I discussed that. This is what I'm seeing now. How can we get you to the healthiest you?
Right, exactly. And, you know, I think what people need to understand is that we do have 830 offices. We have 10,000, you know, employees. And so if you took a group of private practice dentists and you put 800 dentists, I guarantee you that you can find something good or bad about any of them. So when you look at it, that aspect, you know, that we are individually owned, there's individual people and personalities at each office, but no matter what our shortcomings are, I can tell you from this end of it, at the ADMI end of it, is that we hear you, we see it, and we work every day towards being better. And with that being better, we want the best people because we are only as good as our people. And so that's what we're looking for. So thank you for that. So we're getting kind of close to the end here, and I have a question that I always ask, and it's part of our culture and our, you know, what we are. We are a yes organization. We say that, we mean it. It means it's part of our, you know, core of our organization is being a yes organization. And that is being yes to treatment, yes to our patients, yes to being available to them and open. Can you give me maybe a yes story that you have or what that might mean to you as far as your career at Aspen?
Yeah, absolutely. I love these. Watch me ramble. Okay, so someone that hasn't been to a dentist for 15 years, very, very embarrassed. You see this semi-often, more often than you'd like, right? And the patient apologizes profusely. I'm so sorry. I'm so sorry. You know, you're here today. Let's take care of it today. That's what counts most. Getting someone to maybe diagnosing them with something that's awful. You know, they saw it coming, maybe they didn't. Treating them and seeing them again and them having this new quality of life. You know, I had no idea, and now I feel healthier. I look healthier. I would say perio patients are the best for that. Those that just getting them back to health is my favorite thing to do. And it's rewarding for you and them. And I would say those that are most embarrassed or even crying in the chair. I've had patients cry, and I sat with them and I cried, and we closed the door and, you know, let's do it. It's awful. Let's attack it. Let's get over this hump and let's get you there. And then when you see them however long later, they cry with you again, they hug you. And it's odd, but it's great.
Yeah. Yeah. Those, you know, being able to say yes to patients and having that at Aspen, you know, and other practices I worked in, I was told, you know, no, don't probe these patients. No, don't do this. No, don't scare them off, you know, and so these kind of rewarding things that you're talking about, we see on a daily basis here because we are saying yes to patients. We are treating patients for the person and not just, oh, we don't want to scare them away. This is what you have, you know, individually, this is what you have. So, you know, my yes story, I have a million of them, but as a career, for me, my yes is that Aspen gave me the chance to say yes to my career, to be able to have a career that I'm proud of, to be able to, you know, be patient oriented and to then go on to be able to do what I'm doing now is something that I never thought possible. So, you know, that's my little yes story, but I want to thank you so much, Kaylin, for taking the time out and being with us tonight. I really appreciate it. It means a lot to me. I can see your passion for Aspen and that's what we love to have. So for anybody, if you have any more questions or something that we didn't get to tonight, my email, my address, you can always reach out to me, and hopefully Caitlin and I will be able to work together again in the future. So thank you so much. Have a great night. And bleed blue.
Absolutely.
Thank you guys. Bye-bye.
Right.